Hi, my name is Dana Ellis, CEO of First Choice Medical Billing. I've been doing medical billing for over 2 decades. I love what I do, and if I won the lottery of a few billion, I'd change some insurance laws so providers could get paid better. I recently decided to start my own YouTube channel, and as you can see, I'm a newbie, which actually years ago, if you asked, I would have laughed. Today I'm going to discuss MNRP and MCR2 briefly. I get asked all the time about the subject and it can be really confusing, so I'm going to shine some light on it, but just briefly touch on the whole thing. I'm going to break this subject over in segments since it can be so complicated and people don't quite understand it. So bear with me. Out-of-network primarily was provided to offer customers the choice to see a doctor of their choosing. Normally, insurance companies reimburse claims from out-of-network providers at a percentage of usual and customary. Change in particular area, although might be higher deductible for using an out-of-network provider. Now under the program that goes by the name of Maximum Non-Network Reimbursement Program, MNRP. Some third-party payers are reimbursing at a percentage of the Medicare rate. Medicare is primary service offered to elderly. Many users of private insurance are not yet retired, and many require services such as labor and delivery that would normally not be provided by Medicare. Medicare does in fact cover such services in cases involving disability, but these services may be outliers, and the data used to set up charges may not be as reliable as data for services Medicare more frequently provides. MNRP to a customer can be a serious increase in costs as well as to providers. Formerly, a customer would have to pay a coinsurance of, let's say, 20% usual and customary bill, with the insurance paying only 80%. However, with Medicare rates being significantly so low and the insurance company paying just 140% of the Medicare rate, whatever's left over is the responsibility of the customer, your patient. MNRP or MCR2 are some terms that the insurance companies use when applying Medicare rate for non-par or out-of-network provider or facility. In most cases, each plan has a Medicare rate that they use, 110% or 150% of the Medicare rate. You can call an insurance and ask what the rate methodologies they use for a patient's plan, and they should be able to tell you. Insurance has the option to use any one of the 3 rate methodologies for out-of-network providers. UCR, which is usual customary rates, MNRP, maximum non-network rates. Then there's negotiations or proposals that the office has the option to sign, or even sometimes the patients. I've seen some employer plans that send certain out-of-network claims to several different pricing companies for Medicare rate pricing or discounts. Here's a calculation of this, a Medicare calculation example. Medicare's fee, let's say $80, times 1.5% or 150% would equal $120, minus 1.5% or 150% of any additional codes. To apply the multiple procedure or multiple surgery discount for the second line and on. Now, minus the coinsurance or times by the plan allowed, the plan covers at 50% for out-of-network. They're taken away, taken away, taken away. I've noticed that some plans don't apply the plan's covered amount when using the MNRP rate, but there's nothing that I found that says they can't, so you may see several different ways your claims paid, even for the same patient, and believe it or not, even for the same service. Let me give you another example. CPT code 64493, let's say it's an estimated charge of $1,079. The estimated reimbursement would be $70.16, which means your patient has an out-of-pocket of $1,008.85. Adjusting estimated reimbursements. The estimated reimbursement amount is set at 50% for the procedure for plans of out-of-network allowance. Adjustment after 150% of Medicare rate applied. If you like this and want to see more or hear more, please leave your comments below and follow us on Facebook and Twitter. I'm going to leave some resources and some links that you can check out regarding this YouTube video.